We've talked about RAD, Reactive Attachment Disorder, on Ask Doctor Gil before. Today, I have a very special guest, Esther Prelog, who is going to tell us more about this condition and how to treat it. So stay tuned. Hello and welcome to Ask Dr. Gil. As I mentioned in the introduction, I have a guest today, Esther Prelog, who is a psychotherapist. Welcome to the program, Esther. Why don't you tell us a little bit about yourself?
I am a licensed counselor in Oregon, and I have a master's degree in counseling with a youth and child specialization. And we do neurofeedback, so I know a bit about that, and EMDR, and I've been working with trauma for about 10 years.
Awesome. So this podcast we're focusing on reactive attachment disorder, or RAD. And can you tell us a little bit about what RAD is and how to recognize it?
Sure. So during the first 3 years of life, primarily during the first 12 months of life, but during the first 3 years of life, um, so much important brain developing is going on. And reactive attachment disorder always stems from trauma, abuse, neglect, or disruption in the attachment between a baby and a primary caregiver. And that could also be because of chronic pain. The brain doesn't know the difference. So it's going to be stemming from a disruption in that first 3 years of life.
Chronic pain in the baby is what you
Yes.
mean. Yeah, okay.
It could also be, it doesn't necessarily have to be purposeful abuse.
Got it.
So
Yeah, no, that makes sense. Yeah.
it could be from an illness or colic. And reactive attachment disorder is a spectrum disorder. So we're going to see a variety of symptoms, and some will be really extreme and others might be mild.
So what might some of those symptoms be?
Symptoms could be anything from as a kid gets older, lying, manipulative behaviors, lack of empathy is going to be a big one.
Mm-hmm.
And it could be violence, rage, killing animals, and things like that. So really, going back to what happens with babies, I think a great way to understand attachment is a story that someone told me when she was an adoptive mom, and she went to check out the orphanage where she was going to be adopting her child. And it was a really awesome orphanage, great staff, clean, and there were nuns working there, very kind people. But, they were doing the very best they could, the staff was. And the mom said, "This place is so great, but tell me something. Why is it so quiet?" And the staff person looked at her with very sad and sullen face and said, "They usually stop crying after about a week or two."
Oh, wow.
So the babies, they're coping. So babies will cry, and that's a plea. Help me relieve my stress, my distress, my wet diaper. And for them, it's life or death. And once the babies are crying, saying, please help me, they learn that that's not going to get their needs met. And so they'll stop. And so fast forward years later, and we'll see a 7-year-old client who can't ask for help, doesn't cry when they get hurt, doesn't understand other people's sadness. So that makes sense.
You and I have talked about this in terms of, because I work on the medical side of the RAD. And when I first started seeing patients with RAD, I noticed they didn't have a lot of physical symptoms.
Yes. And I think that's exciting. I get excited about that. The body is just really in this fight or flight. What happens to the brain, as you well know, frontal lobe is lower functioning. really that logic and reason and cause and effect, and the brain and the body are in this survival pattern, and it gets stuck there just as a way to survive. And so most of the kiddos I see don't have any glaring medical issues, and once they start healing, they'll get sick for their first time. Because if you think about getting sick, having the flu or a fever, you need someone to care for you.
Right.
So it's a
Right.
very strange thing that we get very excited as kids are starting to heal. They'll get a fever or have the flu, and then their moms or dads can take good care of them during that time.
Right. Yeah, it is kind of funny. I'm smiling about this because I remember the first time I said that to a mom with the patient had RAD, and the kid came in with a fever, and I was like, "Yay!" And the mom looked at me like I had three heads, you know. So I'm like, "No, this is good news."
Yeah,
So
it's so exciting.
yeah,
Like I had a mom say to me, uh, he just threw up for the first time in his whole life. He's 15 years old. He's never thrown up before. And we
and
were all so happy.
so how do you differentiate how do you recognize this? Actually, let's start there. Like,
So
yeah, go ahead.
how are we diagnosing it?
Yeah, yeah.
I'm going to go on a tangent. I listen to parents. A lot of times kids are presenting 100% differently in public than they are in private. So it's really about listening to the parents. Parents are feeling overwhelmed, and it's tricky to recognize. So I'll see clients that are very polite, kids that are very polite and even compliant, but they're dysregulated. They don't have the ability to self-soothe, and they lack empathy. Um, and so it's really working with parents and helping them to understand that this is brain damage. I wish people would look at RAD just like they would look at any other illness like autism or ADD. Um, and so I listen to parents. That's the number one way that we're going to diagnose it, and um, look for that lack of empathy is probably the number one thing that we're
Okay.
looking for.
Yeah, that makes sense. That makes sense. I mean, and by the way, just for the listeners, and correct me if I'm wrong, Esther, but if you look up RAD in, say, Merck manual or in DSM, and then also kind of what you do, like there's different definitions of RAD. Though
It's
the core is around some form of neglect or trauma at an early childhood, but there doesn't seem to be one definition. Am I correct about that?
Oh yeah, yeah.
Yeah.
It's not well understood. It's tricky, and
Yeah.
a lot of clinicians, a lot of clients that I'm seeing, parents are saying, we've been to 3 or 5 or 10 different therapists that did not diagnose it.
Hmm.
It's tricky to diagnose, and it's not well understood in the community,
What
and
are
it's very isolating for parents to
yeah,
deal with that.
yeah. And what are some of the other diagnoses that you've heard parents say and you've said, no, this isn't what that is. It's RAD. Um, yeah.
You can add to this list, but ADHD, ODD, learning disabilities. I've seen those things go away with treating attachment disorder.
Right. And ODD for people out there is oppositional defiant
Mhm.
disorder. And that's something that we have talked about on a number of occasions, and sort of how do you distinguish between RAD and ODD? And is there a quick thing out there that we can talk about as to what the differentiation is? Because a lot of the behaviors would be the same on the surface, at least, particularly as the kid gets older.
Yes. I was talking to a colleague about this, and she told me a funny story. She just said, "Rad kids, they may act like gamblers. They're stuck in a loop, and they do these behaviors, but it's not necessarily for a certain outcome. They in fact they'll often get a negative outcome. Uh, and ODD kids, I what I notice is that there's a purpose to their behavior. It's always going to be early childhood trauma. So if that's not there, then it's not rad. Often we're seeing kiddos with ODD that have secure attachments and possibly a permissive type environment. So maybe overindulgence or that's going to be anger.
Okay.
So I,
That's
I won't diagnose unless there's some disruption in the attachment in early childhood. So that's one difference between ODD and RAD.
but
But
you
the RAD kiddos, sometimes they're getting a certain wanted outcome for their behavior. Sometimes, not always.
mhm. Almost like there's a compulsion behind the behavior as opposed to the ODD kids might be doing something to manipulate the situation around them. Is that
Possibly.
I mean, it's not like I mean I've had rad kids come in and they're definitely trying to manipulate things around them as
They
well.
Yeah, they can do that. They're just
Yeah.
stuck in this loop where sometimes they're looking for a certain outcome, definitely. Those RAD and ODD can overlap quite a bit.
Okay. That's fair.
So it's but I look for a secure attachment. Does the person have the ability to attach to anyone?
Uh-huh.
Uh, And is it a genuine attachment?
Okay. So empathy maybe is that
Yeah, oftentimes the ODD kids have remorse. Um, it just depends. Every person is so different. It's hard to say.
got it.
But in either way, when we're treating attachment disorder versus ODD versus ADHD versus autism, a lot of the treatment's going to look the same.
We're going to take a quick break, and when we return, we'll talk more with Esther about reactive attachment disorder and the treatment for it. So stay tuned. Okay, welcome back to Ask Dr. Gil. I am your host, Dr. Gil Winkleman, and I am speaking with Esther Prelog, licensed professional counselor here in Oregon. Before we continue with her, I just want to remind people that if you have any questions, you can send an email to info at askdrgil.com. And at the end of the program, I'll also give you Esther's contact information in case you want to talk to her or look her up directly. I also want to remind people I am working on an e-course, the topic of which is pyrrole disorder or pyroluria, which is tangentially related to RAD. We see a lot of pyrrole symptoms and actually pyroluria in reactive attachment disorder. But let's get back to Esther. And so, Esther, let's talk about how you treat RAD from the psychology, the psychotherapy point of view.
So even with the best, most effective therapy, I cannot fix this in an hour a week. So parents will do all the heavy lifting, or the caregivers will
Right.
do all the heavy lifting. And really, we look for a child's developmental age and their emotional age. And so the brain is getting stuck and there's some damage during those formative years. And typically, we'll see kids at an infant or toddler stage. And so how would you treat a toddler? Um, it's
And
really
and let me just clarify, when you say toddler stage, you don't mean that they're actual toddlers that you're doing therapy with, but developmentally. But in general, what you're saying is developmentally though.
Yes.
Is yeah, okay. Yeah.
Usually, we'll see kids, as you know, that are 8, 10, even in their teen years, that are having a lot of emotional regulation problems,
Mhm.
as if they were a littler kid. So I search for the age kind of where they are emotionally, and that's often in that toddler. kind of stage where they're having meltdowns, they're easily dysregulated, overwhelmed, confused. And the premise of successful therapy, I think, revolves around nurture and structure. And just like you would with a toddler, um, you would make their world smaller. This is the part where it's really hard for caregivers because it can be seen by our culture as abusive or overly controlling. And that's not what I'm talking about. I'm talking about helping kids get to conquer their own worlds. And in order for them to be able to heal and conquer their world, they need a small world to do that, if that makes sense. And so
Totally. Totally.
really helping helping them with structure and routine. So if you let's just say you had a 2-year-old that kept trying to touch the stove, you wouldn't give them a long lecture about why that's dangerous. You would say no and move them. And so it's difficult for caregivers, but it's a total restructuring of the household. And then you wouldn't take your 2 or 3-year-old to a rock concert. So we can't take dysregulated teenagers to things like that either.
Mm-hmm.
It's too hard for them to. So really focusing on regulation and parenting and caregivers, they all need to be on the same page to send this message of you're safe. And it's action oriented. I can't stress that enough. If you took an adult that got in 5 car accidents that were of no fault of their own, you wouldn't say to them, "You're safe, you can drive. The road's safe." They wouldn't believe you. I think actually some talk therapy can do more damage.
Hmm.
Um, everything we do needs to be action oriented and kind.
I really like this a lot, and it's great that you're explaining that the way that you just did, because it's as far as setting up the environment of a toddler. Because from my perspective and as a naturopath, we look at the development of the body, that the organ systems develop over time. And I should do another podcast about this. But, for example, between conception and 2, that's when adrenal kidney is sort of developing, which has to do with survival mode and routine and regulation. So you have an injury at that age in a RAD case, right? I mean, that's basically what you're saying is that there's trauma, physical or otherwise, and there's a dysregulation that goes on. And fast forward to adulthood, well, you can't regulate your adrenals very well. And this is true in someone, even if they're not RAD, right? So one of the treatments for that I give adults is you need a regular bedtime. You need to eat meals at a regular time. Don't vary your schedule. Don't have, work swing shift and day shift, that sort of thing, because that's going to disrupt any healing that happens with the adrenals. And that's kind of what you're saying here with these kids, like keeping the structure in
Absolutely.
place.
Yeah. And that's right. And it's actually exciting because if we just look at it as just how you would treat anything, and then if you think about an adult who has adrenal fatigue or some health problems that you're treating in your office, and if you have a patient and you're saying to them, don't work too much and don't stress too much, well, what ends up happening to those bodies that are stressed out when they have, quote, downtime? That's usually when they get sick.
Mm-hmm. Totally.
And
the analogy is the reason that if you have a couple of bad nights sleep in a row, and then you have and you're functioning fine, and then you have this good night's sleep, and the next morning you're tired, right? You're feeling tired, not because you had a good night's sleep. You're feeling tired because your body said, "Oh, I got rest. I can start some healing processes," and that takes energy. Yeah. So, wow, that's awesome. That's really awesome. Is there anything else that you would really like people to know about RAD in general, as far as either recognizing it or treating it or healing? If they think, "Oh, maybe I have that,"
Right. Well, there's a ton of hope and healing out there, and that it's controversial. Maybe that's the wrong word, but it's a taboo. I just see so many tired and sick parents coming in doing the very best they can in every way, and it's not working. And so, and there's not a lot of support in the culture around this issue. And so if I had one thing to tell parents and caregivers, it would be, there's hope and get help, because treatment does work, but it needs to get treated. It will not go away on its own. And you're not alone, because so many parents come in and think, what did I do wrong? Especially if their kids aren't adopted or traumatized at an early age. What did I do wrong? Really just kind of stepping back and looking at it like you would look at any other illness. And then you would treat any illness very early on. So I would tell parents and caregivers, don't wait. Don't wait. And
I
adults get therapy too, for
Yeah,
sure.
I think that's a great message about not waiting. I mean, from my perspective, a lot of the treatment that I do on the physical side to help, and I consider what I do in terms of RAD very much an adjunct therapy. But, in terms of helping calm the body down, it's really hard to get kids, or teenagers rather, to take vitamin supplements,
Mhm.
on a regular basis. It's hard in the best of conditions because they're kind of scatterbrained and all over the place. So in a RAD case, it's like better to do it before they hit their teenage years. For sure.
Absolutely.
Yeah.
Absolutely. And it's going to be that way with every intervention. It's just going to be easier when it's done earlier.
Yeah. Yeah.
It's a the treatment needs to be brain, heart, body. It's a really holistic approach.
I like that, given that that's sort of my logo and the heart, body, brain
Right.
aspect
Right.
of things. Yeah, I think that's great. Well, I want to thank you so much for joining me today, and I'm hoping that people will have questions about this, and they can send an email in to info at askdrgil.com. Which actually reminds me, Esther, you have a website, and people may want to get information about this from your site, because you probably have a lot more information about it than I do on mine. What is your URL of your site?
PacificCN.com. So Pacific Counseling and Neurotherapies. We're still working on adding some information to the website.
Great.
That's Pacific, PacificCN.com. Esther, thanks so much for joining us on the program today. This is, I hope, very helpful for patients and for the listeners. And if you have specific questions, again, you can email them to info at askdrgil.com, or go to Esther's website and see if there's information there that could be helpful as well. And that's all we have today, and we'll look forward to catching up next week. Thanks so much.